Good morning, guys. I came on 10 minutes early today to talk about two people that I've recently popped on my radar. The unbelievably talented and crazy fit Emily Rolfe. I haven't had the pleasure of having her on the show before, and this guy, a CrossFit Games Masters athlete. Emily Rolfe yesterday had or a couple days ago had two clots in her arm, as far as I can tell, and her arm started turning blue. They rushed her to the hospital. Then this happens. This guy's competing at the CrossFit Games, and he also has
vascular event.
What did you call it, Tom?
A vascular event.
A vascular event. And it sounds like basically he had a clot in his brain that caused him to have a stroke. Dr. Tom Siskron is L1. He is a urologist. He's been on the show a couple times. And this morning I sent him these and I was like, hey, could you come on for a few minutes and I just bomb you with some questions? And he said, sure. In the 15 years, 16 years I've been following the CrossFit Games, I've never, ever heard of anyone. By the way, these are both Canadian athletes. And I presume that to come into this country, you have to be vaccinated. And so I assume that they both have been vaccinated. Emily actually made a post about the time she got vaccinated. So I believe her. I wasn't in the room when the doctor, gave them the injections, but all facts point to the fact that they are both vaccinated. And I also don't know what the main vaccine is in Canada. I don't know which one they took. But basically, good morning, Ken. I'm just tripping that this happened at the CrossFit Games twice when I've never seen it happen before, and I was curious to get yours and Ken's thoughts on it.
Yeah, I would love to know their vaccination status. How many they've been, how long it's been, but one of my main talking points through this whole thing is that being metabolically healthy and active is a way to protect yourself against these types of things. Not only these types of things, but COVID, through the COVID crisis. Is my main point is you don't have to worry about it if you stay healthy and eat right. And I've never heard of, to this point, any CrossFit athletes who are real athletes, not people who are unhealthy and then join a CrossFit gym and have an event or get COVID, but real athletes. These guys are at the CrossFit Games. They've been doing it a while. They're healthy. By Greg Glassman's tenets, CrossFit drives fitness, and fitness over time is health. So they're healthy. I haven't seen anybody die of COVID, and number one, who's this fit. And number two, have we ever seen CrossFit athletes getting clotting events? Both of these are clotting events. I'd like to see the data on that. It's just a red flag. We can't just keep ignoring all of the little clues that something's going on.
Ken, do you have any, thanks for joining us, Ken, long time. Do you have any thoughts? Why is it that exercise exacerbates this issue? Why are we seeing, I'm making the presupposition that it's something that has to do with the vaccine and then working out at high intensity. Do you have any thoughts on why it's happening to soccer players, basketball players, CrossFitters in the heat of the moment?
In the medical field, there's this kind of an accumulation of problems that can predispose people for clots. And usually there's some sort of a traumatic event, whether that's even just the vessel wall being damaged to some extent, or you've heard of people having clots on planes where they're sitting still for long periods of time, and so venous stasis, so where the blood just kind of pools and sits. But I mean, we're talking about some elite people here. That's what's just bizarre. And I know we can't tie A and B and say that the vaccine caused these people's clots, but as Tom said, I mean, it's just strange that we hear about the most inflammatory portion of the virus becomes the thing that your body reacts to for the vaccine. It's what they chose to use for the vaccine. And now we have all of this inflammation, i.e., and then leading to clots and vascular events. So as far as just exercise in general, I don't know. I mean, there's some dehydration component to it, which could be part of the issue. That and when you are slightly dehydrated with vigorous exercise, as some of these people are doing on the soccer field, CrossFit, extreme CrossFit, then that is going to make the blood inherently a little thicker, just because it is dehydrated. We know that the vascular space becomes less hydrated, so there's more blood cells per any unit you measure. So it's kind of like sludge, almost a little more sludgy. That can predispose to clotting too. But these people that, and it sounds like the little bit I know about, was it Rolf?
Yep, Emily Rolf.
That she, that was an arterial clot, right, Tom? Did you read that?
It's appeared to be because her hand went blue.
Yeah, she was cold and blue. I mean, that's not a venous clot. That's not your typical clot in your leg that you hear about. That's an arterial, and that's a big deal.
Yeah, to your point, I mean, I know a young woman when she was 35, but now she was on birth control pills, which, I don't know her status, but she was on birth control pills, which is known to exacerbate clotting disorders in young women. And she was
typically venous, though, right? Huh? Typically venous clots, correct?
Well, this was an arterial. She was parasailing, and it jerked her, and her head whipped back, and she got a little arterial disruption of the intimal wall in the vertebral artery, and through a clot, and had a stroke. So, your point to minor traumas being inciting events, that's true. And obviously, Emily, when I think she was doing the bike, I mean, that's a lot of shear forces on those arteries. So, there are other explanations for this, but
it's got to be somewhat poignant that let's say there's 200 athletes at the CrossFit Games, and 100 of them are vaxxed, and 2 of them have clotting events, and it's just the vax ones. Now we're starting to get some data, and I realize it's just a study, of just those people. But I find it very, very, very odd.
And it's worth investigation rather than the mainstream saying, "Oh, y'all are conspiracy theorists," because doctors are good at recognizing patterns. And even as a urologist, I am recognizing patterns in the patients that I see. I had a 48-year-old woman in my office who had a blank stare, and her husband brought her because he thought she had a urinary tract infection. And I was worried about her because she was not responding normally, and sent her to the ER. She had a stroke, and she was like 2 or 3 weeks after her vaccine. I had a good friend from grade school, healthy, exercising guy, 50 years old, died of a stroke after his vaccine. I mean,
and how long have you been a physician?
In 97.
So 25 years, and these stick out to you now? What if I were to ask you, but this happens every year, Dr. Siskron?
I would say, yes, it happens to certain people, but I'm seeing it more in people that it doesn't normally happen to, like CrossFitters and people who have no other history at all, who have these weird, right after the vaccines were started in, what was it, early 2021, is that when they came out? I don't remember. Our hospital ran out of TPA, which is the therapeutic drug they give for clotting disorders.
I was just getting ready to mention that.
The hospital ran out of the anti-clotting drug right after they started these vaccines. And it's just well known that the spike protein in the disease COVID-19 causes clotting disorders. That's why people who get COVID have heart attacks and strokes. So you take that same spike protein and you load it into everybody on the planet, and you say, "Oh, these clotting disorders aren't related to the vaccine." It's just where there's smoke, there's at least something going on, and it needs to be investigated by somebody who's not from the government and not from Pfizer or Moderna. It needs to be independently evaluated.
If you're an athlete out there, and you've been vaccinated and you're concerned, is there any precautions they could take?
Geez, I don't know. Just stay as healthy as you can if you've already been vaccinated. I don't know the data on how long the spike protein and those nanoparticles hang around. I've read reports that they're being found months later in tissues that have been biopsied. So, and your body is going to mount an inflammatory response to these things, to foreign objects. And, I don't know the data on that. I'm just a dumb urologist. I'm just noticing a pattern in the patients that I see and in things like this, all anecdotal, I will admit, but somebody's got to be looking into this and not just discounting it.
Do you agree, Ken, that this needs to be looked at? Two CrossFit athletes both having clotting. This is weird.
I agree. It's weird. I mean, when I saw the Emily Rolfe post, I was just amazed. I mean, somebody at the peak of the pinnacle of human fitness just spontaneously has an arterial clot. That is bizarre by any standard. So yeah, I mean, I think someone should look into it. I think it's become such a political hot potato that, now we're gonna take our tinfoil hats off after the show, I guess. But that's how this has gone. Now it's all political. There's no medicine anymore being discussed as far as epidemiology and studies, that people just want to automatically go political with this. And that's not, I don't think that's not what Tom and I or either one of us are saying is, just look at this. Just, yes, okay, the vaccine's out. Yes, millions of people have had it. We're there. We're beyond the argument of whether to take it or not. People that are going to take it have already taken it. People that don't have it and probably never will. So let's now move forward and find out what this is.
Sounds wise. Final thought. Both of these people, from what I can tell, one more explicitly than the other, says that they're so happy that they were in the United States when this happened. These are Canadians.
Yeah, I saw that. It's amazing.
Because of the way our health system is set up. Can you vouch for that? That if you're going to have an event like this is the place to be?
I can. I mean, I can definitely say that. Now, where is Emily? Is she Canadian as well?
Canadian also, yeah.
Okay, so both Canadians. And we have a good friend in our gym. Tom and I have a good friend who's a weightlifting coach who's Canadian, and he just echoes the same thing. He's like, he now lives here most of the time, and he says the similar type of thing as we've all heard. You want to be in the U.S. if you've got serious medical problems, or you want to get them looked at abruptly.
I'm not a fan of socialized medicine, but, and our system is broken. But I have heard that for acute events in Canada, emergencies is better than your chronic thing. Like if you tore your ACL, you may wait a long time for your knee surgery, but for acute things, it's better. I can't speak to that, but that's what I've heard. But I do know, like the guy in our gym who say that it's better if you get sick to be here, but I don't have any firsthand knowledge of that.
Okay. Thank you guys for coming on. Everyone, thank you for being patient. I think this is an important topic. I really hope that since we've seen 2 events, that doesn't mean that there's 5 just ticking, waiting to happen. We may either find out or not. And more may have happened and we just don't know also, by the way. Sorry, go ahead.
Can I add one last thing?
Please,
that the insurance data, and I have not verified this, but I read, and I believe I forwarded it to you, an insurance CEO saying that they're noticing a significant increase in all-cause mortalities in younger age groups. That's absolutely not normal. And if anybody's going to figure it out, it's going to be the actuaries and the insurance companies who are going to say, look, all these young people are dying of weird things now. What's going on? So maybe
that's a scary... when insurance people start talking, because I know that they are the real scientists. It's scary. I saw that article. That is terrifying, especially if you're between the age of 18 and 44.
That may be where we need to eventually get the answers, is from the insurance companies and their real world data on who's dying and of what, and who's having clots. I mean, now Emily Rolfe is going to be in a database somewhere as a, however old she is, person with a clot in her arm. How does that compare to 10 years ago? So that's where maybe the things are going to get ironed out.
Go ahead, Ken. Before
I was just going to say it's terrible that this 2022, the bean counters with the insurance companies are going to drag us to maybe the truth about this whole situation.
Yeah. Well, hopefully someone will.